May 13th, 2025. And Ms. McDonald, would you please go ahead and call the roll?
Mayor Slanka?
Here.
Mr. Richmond?
Here.
Ms. Zipsey?
Here.
Ms. Baggett?
Here.
Dr. Zollett?
Here.
Ms. Lawley?
Here.
Mr. Bonnell?
Here.
Ms. Miller?
Here.
All right, thank you. Do we have to, is everybody here accounted for? And do we have any guests today? No. All right. So the next item on the agenda will be the approval of the April 2025 minutes. Is there a motion to approve the minutes?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion about the minutes before we approve? Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Zipsey?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yeses have it, and the motion passes. The next item on the agenda is our education presentation. Oh, I'm so sorry, I didn't see that. To receive and file our financial report from April of 2025. Is there a motion to receive and file our financial report?
So moved.
Thank you. Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion before we proceed?
I just have, we submitted our annual financial report that's due to the state every year. And we filed that yesterday. And we will be having, in the coming months, we're trying to get some small little orientation for the finance committee. Amy, Tiffany, and Joseph, a little financial, what do you call it, class, if you will. So we're trying to get these reports in some kind of fashion where you guys will understand it as much as we understand it, but it's basically all finance. Most health departments are county health departments, and they do their own financial stuff, and they send it to the auditor. All the things that we do, we submit to the finance department, and the finance department puts it under. So it's a little different, but we're gonna show you how, when you read these reports, where everything's coming from and going to, and then we'll, after we get it from you three people, we can present it to the board for the whole board, so everybody's on the same page. But that'll be coming up, and it'll be Carla and I in those meetings with the members. So we'll be reaching out to you soon, just to see what's a good time to meet with you. And I'm sure no longer than an hour. It's gonna be pretty simple, but at least we'll be seeing it from your eyes, and you can ask us questions that we can take back to finance. But we're gonna try to start over, because people have been looking at these finances for years, and now we have a different finance department, a different system, and new people. And so it'll be better just to start from scratch and start over. So that's to come.
I'd like to say, maybe we can open that up to anybody who would like from the board.
Oh, yeah, anybody can come, but it'll just, if everybody comes, it'll be a public meeting that we will, and that's fine too, but we're just kind of scratching through our numbers to see it, so that'll be good. So, and yeah, anybody can come. I was gonna use our finance committee to kind of get that rough draft for the whole board and
Okay.
do a presentation, but anybody will be welcome.
Well,
to
that
come.
works too then.
Yeah.
Just
Yeah,
because I
either
think
way.
maybe we might all have like questions we
Right.
might want to ask.
To move things around or
Mhm,
whatever.
yeah.
Yep, that's fine. So that's
That
to
works
come
too.
to, yeah. Okay.
Well, thank
That's
you.
all that's only mentioned.
Thank you. Any other discussion about the financial report before we move on? Okay, seeing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Zipsey?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
Yeses have it, the motion passes. Thank you. Okay, the next item on our agenda is our education presentation. Dr. Genowine. Or no, I'm sorry, Chandra Corbin, please read them.
Actually, so when I went to the AOHC conference with Jackie a couple weeks back, I learned that Kent State University actually has a Board of Health learning tool, like their the contact hours that you guys are to receive. So this is one of their videos on data visualization.
Hello, and welcome to this presentation on data visualization for public health, concepts, tools, and applications. My name is Diana Kingsbury, and I'm the Director of Research and Analytics for Summit Education Initiative in Akron, Ohio, an organization dedicated to improved educational attainment for students in Summit County from cradle to career. I'm presenting this material on behalf of Dr. Enrico Gandolfi, Assistant Professor in Kent State University's College of Education, Health, and Human Services. And in this presentation today, we're going to be talking about different techniques, uses, and methods for visualizing data within public health. To begin, I want to introduce you to what data visualization is. At its simplest, data visualization is a technique that's used to take data or information and visually transform it for use within the public. Data visualization occurs anytime we take a piece of information and visually represent it for the world to see. Data visualization has many applications within public health, which is what we'll be discussing in this presentation. When we're seeking to take data or other information and present it to others, we're working within this data visualization realm. Our goals for data visualization are creating imagery to illustrate the information we'd like to share, to take this image and share it with others, and to make data and information accessible to groups. Quite simply, data visualization is a process of taking what can be complex information and presenting it in a usable, interpretable way through some data visualization technique. We'll see examples of this as we go through this presentation. Data visualization is not a recent phenomenon. It was not invented when computers came on the scene. Techniques for visualizing information can be traced back into history. We can think about cartographic maps dating back to medieval times and beyond. We've always worked to make sense of the information available to us, and visually representing it helps to make the information more accessible. When we think about this in public health terms, there's many examples of how data visualization was used to understand public health phenomenon. On this slide, we see Edmund Halley's life table. Edmund Halley of Halley's Comet, that is. While not charting stars and doing astronomy, Edmund Halley worked to make a mortality table to calculate price of life annuities in the 1600s. This is one of our first visual examples of studying mortality rates. And you can see in this image that Mr. Halley had taken public health information and data and presented it in a way that could be understandable and usable to others. It's not simply the reporting of figures, which is essentially what his goal was, but is visually representing relationships between these numbers. Here we see a very classic example of a public health data visualization tool from the 1800s. This is John Snow's famous map of Broad Street during the cholera epidemic, where he visually represented the outbreak and was able to trace the source to the well pump. It was this map that stirred the development of epidemiology as we know it today. We'll see later in this presentation some more recent examples of data visualization for public health. Today, data visualization is known for its many uses and features. If you're familiar with infographics, that's a data visualization technique. Data visualization today includes elements of storytelling to make the delivery of information compelling. It's also interactive, where users are able to not only learn information, but also interact with it as well. Finally, data visualization has grown in its elegance and capabilities with the boom of technology in modern times. So again, our goal when we're visualizing data is to take information, to tell a story with it, to make it usable and interactive with the end users, but also to make it simple in design and visually appealing in its elegance. If you're interested in engaging in data visualization techniques, you begin with your goal in mind. What information are you trying to convey to large groups of people? We have many examples of this within public health. Perhaps you're interested in conveying COVID rates within your county. You can visually represent that number to make a compelling case to people about social distancing and wearing masks. You also want to understand your audience. Who are you trying to reach and why? What type of visualization will reach them most effectively? You then select the information you're sharing. Within public health, we often have more data at our fingertips than we know what to do with. Here, you want to select the data you want to convey to people along with these other procedures. Finally, you want to pick the most appropriate way to visualize the data. Again, this is thinking of your audience, thinking of the tools you have on hand for visualizing the data, as well as thinking of the data itself. Some data lend itself very well to mapping. Some data lend itself very well to charts and graphs, and others might lend themselves to infographics. So it's important to understand what you're trying to convey and to select your visualization tool based on that. Fortunately, visualizing data does not have to be an expensive enterprise. There are many freely available tools on hand for visualizing data. We share some links here that may be of interest to you if you'd like to start working on some data visualization of your own. Here are some examples of how data visualization tools are used in public health. Johns Hopkins University maintains a coronavirus resource center that includes a map of COVID-19 cases by county. This is a map that's updated in near real time that you can click through to see trends in coronavirus transmission. The University of Washington maintains a data visualization tool to explore relationships between determinants of health and health indicators across countries. And finally, the CDC's National Center for Health Statistics reports mortality data via data dashboards to present a variety of mortality trends by country, by causes of death, and of various trends associated with mortality rates. Over these next few slides, we also have some examples of data visualization in the form of infographics. On this slide, we see infographics associated with cancer registries, and this is put forth by the CDC. And you can see in this simple image that it packs a lot of facts, information, and data. So you can see visual representations of the global cancer burden, factors that affect the costs of maintaining cancer registries, and other useful data. In this infographic, presented by the World Health Organization, we can see information about air pollution and its impact on children's health. And you can see also in this image data and information that is presented in a clearly defined way that is easy to understand and interpret, that maybe compels you to act in a certain way or want to take action on this issue. Here's a visualization put forth by the University of Washington that reports daily smoking patterns for males and females across the globe. And you can see in this image where the burden of this behavior might fall, who's most heavily impacted, and then this might also compel you to take some kind of public health action on this topic. Within the current environment for public health dealing with the COVID-19 pandemic, we know that there's a variety of opinions and platforms on what the best way is to mitigate the transmission of the virus. And you can see in this infographic put forth by the CDC in their MMWR publication that the majority of US adults are actually supportive of public health measures to slow the spread of COVID-19. So this very simple image presents data to the general public that makes you think, that might compel you to continue acting in a certain way, or even share this information with others to compel them to act. In this image also put forth by the CDC's MMWR publication, we can see this visualization of COVID-19 hotspots by county in the United States from March 8th to July 15th of this year. And you can see that this is reporting several months worth of data in a visually accessible and appealing way. So these are just some examples of how data visualization can tell a story within public health, can compel people to act, and can present what can be complex information in very simple and effective ways. And I conclude this presentation with my thanks for your attention during this time, and I've also included my contact information along with Dr. Gandolfi's if you have any questions or if you'd like to learn more about this topic. Thank you.
So obviously that was from 2020. They are working on updating their toolkit. So in a pinch, we can use them as a resource for your guys' trainings. But it does show, you know, the way we do use visualization. I mean, even if you look on our website, we do a lot of infographics to get messages out.
Yeah, they're very helpful. Any questions or comments about the presentation? All right, well, thank you very much. We will move on to the next item on our agenda, which is new business. And let's start with travel authorizations.
None.
None, check. All right, well, thank you. The next item is the review of tobacco enforcement smoke-free investigations, provider agreement.
There are no changes in this agreement. There is just a renewal. It's a 2-year renewal.
Okay.
So this is a smoke enforcement agreement with Ohio Department of Health
And we do this renewal every year,
every 2 years.
every 2 years? And it's just when, remember, I always like to remind people, and just in case for Ms. Baggett, smoking complaints are called in by an 800 number that goes directly to the state, and then the state sends the complaint back to us. So if you ever hear in the community or around people that the health department's coming in to get, if someone has called it in, it goes directly to the state. It's an 800 number. They keep the local health departments completely out of it until it's time to investigate the complaint. And then this is the money that we get in return, and I think it's $175 per complaint when we investigate. And it's just every 2 years.
How long does it take to investigate, usually?
It depends. You walk in and see smoke.
It-
It's pretty. No, go ahead.
Yeah, it takes a little bit longer
I
than that,
know.
because you're not only checking to see if they're smoking, but a violation is if they have to have signs posted, they can't have any ashtrays, and ashtrays or anything used to put out a cigarette. They can't vape in there as well.
Okay.
That's good.
Yeah,
Yeah.
vaping is a violation as well. And we try to go back and make sure they don't have any, ashes in trash cans, and we talk to them, so it could, just that one investigation can take probably about 15 minutes or so.
Okay. And, just curious also, is a violation also if, they have signs posted that you must be 50 feet away from the door or 100 feet or anything like that? Is that a violation? or
No, it's not a violation. You can't have any, it is a violation if there's infiltration of smoke.
Okay,
But, it depends on how the wind's blowing, so, yeah.
Gotcha.
Yeah,
Just
there's
curious.
no footage requirements on that.
all right.
Yeah, that's why I always wonder, it helps when you know a little more about that, right? Because they don't want smoke coming indoor.
Yeah.
And so that's why they try to kind of stay away, or the signs are posted a little away from that, so that you're not right outside the door, so that smoke gets indoor. But
And there's also a requirement for dining, open air dining. You can't have 50% of the walls. Sometimes people will have curtains up, or you have to have 50% of that area to the open air. So
Okay.
you can't have 4 walls, you can have 2, or you can have a covering and then you can't have the walls. So there's some other things that you have to look at as well, so.
And sometimes the state wants us to go out at the time the complaint happened.
Yeah.
And so if someone complained at 8 o'clock at night, they really kind of want us to go back around that same time of the complaint.
Within like 6
Yeah.
hours or 4 hours,
Yeah,
depending whether it's
between.
before midnight or after midnight.
Yeah.
Wow, so like if it's
So
like
it's-
11:30, they're like, yeah.
Yeah.
Okay.
Yeah.
Okay. All right, any other questions or comments? Hearing none, we will continue. Next item are our reports, and we'll start with our health commissioner.
Okay, I brought back something interesting from the conference as well. We had a mental health session, and I'll remind people when Ms. Lawley talks about our walk with the doc this year, this month, it's gonna be on mental health too, but I really thought it was important that this session, we often talk about mental health and what to do and how you can't get your hands around it and how you help people. And so I was talking with our Middletown Connect core group, and just the difference between mental health and mental illness, right? Because they said sometimes that is blurred. And mental health includes emotional, psychological, and social well-being. This is mental health. affects how we think, feel, and act, and helps determine how we handle stress, relate to others, and make choices. Mental illness is a medical condition that affects a person's thinking, feeling, behavior, or mood. Deeply impact day-to-day living and may also affect the ability to relate to others. So those two definitions. But what we got excited about is when you look at how you, indications of good mental health, these are things that we can encourage people to have or give them some tools. Resilient to stressors, empathy, strong relations, so we can say, who are you around? Maybe get them out to community groups or whatever so they can have contact with others. Emotional balance, sense of purpose, sense of belonging, self-confidence, positive outlook, clear thinking, healthy routines, ability to care for yourself, and that all falls underneath mental health. Indications of mental illness, inability to perform daily tasks, feeling numb, nothing really matters, feeling helpless or hopeless, severe mood swings, thinking of harming self or others, increase in drinking, smoking, and drug use, pulling away from people and usual activities. So throughout this presentation, they talked about things that you could do. And fuel your body, prioritize sleep. Sleep is so important. People do not realize how important sleep is. Exercise, laughing, meditate. I love this one. Practice of Shinrin Yoku. And that's forest bathing, which they meant just going out in nature. And just, cause I said forest bathing. That was, got my, foster your social connections, very important. Help someone less fortunate. They always say that helps with your mood and makes you feel better. Pets, everybody's heard about that. Pets, you can get on the cats and dogs. Play, and this is another one, the last one I'm gonna leave you with that I really enjoy. Practice Nikeson. Has anybody heard of that?
What?
I think it's Nikeson. It might be Nikesen. And it's Dutch, and it's the art of doing nothing.
Oh.
And I thought that was pretty cool because, you know, everybody, I don't know about you guys, but sometimes you feel guilty for doing nothing, or you feel like you gotta fill every moment up with something, and sometimes just doing nothing. And so those were some of the things that we said that we were gonna start, you know how when you see people down or whatever, you can easily offer certain things. Exercise, like go to the gym with me, take a walk, let's, you know, knit, let's just do things or whatever, and that can improve your mood. Reading to young kids, reading to elderly people, just going to visit people. And so sometimes you can help people along simply by saying, why don't you come with me and let's go visit a friend. And so those are the kind of things we're gonna encourage, because that could be another way to just integrate healthy mental well-being in people's realm or whatever. So they had, and then they went on, hopefully we'll get some of the slides back from the conference, but they talked about the cost of mental health in the workforce and how many people are out of, you know, lost days of work because of different mental health things. And so to be continued, but it was a good little session where everybody was kind of really leaning in and listening to, especially the forest bathing. I don't know how many forests, I guess we could go to the Arboretum, but isn't there a lot of trees over?
Bulls Run.
Yeah.
Oh, yeah.
Bulls Run,
The
yeah.
Bulls Run is gorgeous for that.
Just to go out in there and just to kind of get into that or whatever, listen to the, so that's it. That was one of the things I brought back from the conference, as well as, I think the mayor will be talking a little more about this, but maybe getting the personnel committee together to look at future planning. And before you came in, Mayor, I will be on a team building exercise with the city Thursday.
Oh,
There's
yes.
extra spots if you wanna come.
I
with
think
us.
I might be joining for a while. Yeah, team building.
Like, I know, that's why I said it's supposed to be 85 degrees.
I wanna watch you guys team build.
I'm watching too. I said I'm gonna be a cheerleader. I have a fear of heights all of a sudden.
Yeah, all of a sudden, today.
Yeah, today. I don't think I like being outside in the heat. So anyway, but other than that, we're just moving right along. Carla will talk about her mental health issues and with Acela and our software. It's been, I mean, I'm not kidding, all of them were grumbling. Even the nicest people were grumbling in there. I think we are starting on that. So I want her to go into a little more detail, whether it's on your report or not, about our new environmental software. Because I think that's about it.
I just wanted to say, Nixon, whatever it's called.
Yeah, yeah.
It says it's a Dutch concept of doing nothing. It's a stress relief practice based on just being rather than being present. So it's not being lazy, it's just like taking it all in. There are benefits to it. Wow, it looks like it can help with burnout. It's positive, it's a stress fighting tactic. So you just have these moments of relaxation and wow, just let it go. Yeah, as long as it's without purpose.
Mm-hmm.
And it's not done in order to achieve something or to be productive. So it makes me think of, is it Shavasana for people who do yoga? That death pose basically where you're just, it's at the end where you're just lying there and taking it all in. That is extremely,
Hard.
but so beautiful.
Yeah, I think it's hard for us just to keep our minds blank and do nothing. You know, it's, don't you? I mean, when, it takes a while to get to that point. I've done yoga a couple of times, and to get to that point, it's just too many things. I'm still thinking about grocery lists, I'm still thinking, I can't settle that mind, yeah.
But that's
So we
nice
need to
bring
practice
up.
that.
Yeah, just be. So
We
thanks for
really
bringing
do,
that
I
up.
think that's.
workshop.
Ooh, I like that. I like that.
A workshop, a being workshop, we can just be, I like to eat when I'm being.
Nothing productive.
That's a potluck.
Well, thank you for bringing that up, very
Yeah,
interesting. I
it
think
was
that's important.
interesting, yeah.
Instead of like you said, like every single minute, that's how, like what else can I do in this minute? But yeah,
Mhm.
very nice, thank you. Any questions or comments for our health commissioner? All right, then we will still continue with our medical director, Dr. Fenimore.
April 2025 reportable illnesses. We had 18 chlamydia, 8 gonorrhea, 7 hepatitis C, 6 pertussis. It was definitely a big month for pertussis in April. 3 hepatitis B, 2 CPO, 2 strep pneumonia, 1 hepatitis A, 1 Campylobacter, 1 syphilis, and 1 TB. And that's all we have.
All right, well, thank you, doctor. Any questions or comments? All right, then we will move on to our director of nursing, Chandra.
For PHEP, the Public Health Emergency Preparedness, we submitted for our final reimbursement. We've met all of our deliverables and submitted them to Butler County, who then submits them to ODH. So our final invoice was sent to Butler County for our, I think it's a little over, it's in the financial, it's around $9,400–9,600 for our final payment for this PHEP contract year. We're still waiting to hear for notice of awards for the PHEP contract for 25-26. Typically starts July 1. State hasn't issued those awards yet. The communicable disease side of it, we've been getting, consistently been getting reports of TB each month, and I check in with Butler County. One of those TBs early on was reclassified to not a case. The second one was iffy. It was TB pulled from an ear infection, so not likely to be TB that is reportable. And we do have an actual active TB case now from a woman who was born out of the country in an endemic area, was not symptomatic when she came here 3 years ago, but is now, shows evidence of TB as being treated, and now a child in the home is also being treated, not symptomatic. So we'll be getting regular updates on that family. Everybody seems to be doing well at this point. This is all very new, it's within the last couple of weeks. And I think, workforce development grant, we're reworking the budget on that, and we did get awarded the $50,000 for the FAB, portion, so that has been added to our budget as well. I think that's about it for us.
Good job. Good work. Thank you very much. Any questions or comments? All right, hearing none, we will continue. Finally, with Carla, our Environmental Health Director.
Okay, so for the month of April, we received two plans, sets of plans. One facility, CT Howell Munchies, I believe that's on Brill, and Frazier's Kitchen on Central. We approved two sets of plans. La Campa, this is gonna be a hard one. I think this is Mexican. La Campachana, anybody knows?
Where is it? Where can I see it?
Oh, yeah, it's
La Campechana.
Campachana, okay, good. And Eddie's, which is on Yankee Road. We licensed, three of those facilities. There's a Dollar General, which is on Brill, Eddie's on Yankee, and La Campachana. So, no change of ownerships for the month of April. We have about 124, septics that have not paid for their operation permit. We have about 75 certified cards that we're waiting to receive back. Once we get those, we'll have to send those to the auditor and about in September, and I'm hoping that we can start our inspections prior to that date, but yeah, those will go to the auditor for non-payments. Yes, we are supposed to go live for Acela, which is our new software for our programming. It's public facing. So we're hoping that customers can pay and submit their applications online. It's going live the 16th of May, Friday. And we're working with IT right now to make it available, the PayPal, we're using PayPal for the payment system. So we're hoping that we can get that up and running at some point. It won't be available probably for a few weeks, but we'll have to take applications and we can still take the applications on the public facing side, but we won't be able to take payments. They'll have to come in the office or pay over the phone. Currently, this week, we're down. We can no longer use HealthSpace, which is the software that we're using now. They're transferring everything over and integrating Acela. Let's see.
I was gonna say, as well as probably trying to move sanitarians to their new location, so all of this is kind of going
Yeah,
on.
just moving all the
Yeah,
documents
all the
over.
database and the physical move and all of
Yeah,
that, so
that's
it's,
all.
and still do our work.
Yeah.
And they've been training too, so training,
Yeah.
moving.
So right now, we can't print any licenses. We can process payments, but we can't print any licenses, which is not really that big an issue. We'll have to wait to send them their license. And everything that comes in, we'll have to upload it, into Acela, once that gets up and running. So Amanda and I spent all day Thursday testing the system. We have to do a smoke test, so we'll spend all day. It'll probably take us all day to do the smoke test, for that. So we're not looking forward to that, but anyway. We have 4 pool payments, that have not paid. They were supposed to pay April 30th, so we're waiting for those to come in, and we've started doing our pool inspections when those payments, when they call in to schedule, the inspections. And, I believe that's it. I think that's it for me. Any questions?
Yeah, I had a question about, you said that we're only gonna be using, is it only PayPal online to pay, or will we also be able to pay with credit cards or
Yeah,
debit?
yes, you
Okay.
could do that, yes.
I was wondering.
That's
because
just the payment, what do you call that, the process, how they process.
It's the portal,
The
yeah.
portal, yeah.
Okay, but
Yeah.
people can also choose to pay with a card of some sort.
That is what they'll do on PayPal, so we use PayPal right now anyways,
Mhm.
we just do it on the backside, so anytime
Oh.
somebody hands us a credit card, we go to PayPal's website and type in the information, and that's
Oh.
how payment's submitted.
Okay.
So this will also access PayPal, but
Mhm.
it'll just be front facing for them, where they just type in their own information.
Okay, fantastic.
And the system, everybody in the state is, not state, there's 62 health departments, they're doing this in phases.
We're the first one.
Yeah.
Great.
So everybody's struggling with the whole system. There's some communication issues and programming issues. All the bugs are not, worked out, and so it's really difficult process right now. But we don't have really an alternative system right now. This is a free system. So we want to go with that. If we were to stay with if we were to stay with HealthSpace, it could cost us up to probably more than like $40,000.
Wow.
So definitely want to go with the system. We don't have the revenue or the budget to hold to try to even go with the new software. So we want to go with the state.
Well, thank you for doing it first. I know that's
Yeah.
gonna be difficult. We can expect
Yeah.
to have issues.
Mhm.
Because we are going to be the ones who are teaching everybody else what not to do and what to do, right? What works and what doesn't work. So that be gentle with
Yeah,
them.
please. Yeah, everybody's struggling with it. It's just the communication with the whole software is not good between, I think, the state and the health departments and the company. They're just not feeding the information out very well. Also, I have been notified, I don't have the documents yet, but we will be surveyed or audited from ODH in the sewage program. We were audited in 2019, and they usually do the audits, I'm assuming every 5 years, so that was the first time. So anyway, I'm assuming it's gonna be for every 5 years, because it's been about 5 years, right? So we'll see, I'll get the documents, and of course, they'll be in the packet, that's June 3rd.
No, okay, good. Good to know.
So
All right.
that's it for me.
Thank you. Any other questions or comments?
I have one about vital stats. Remember I brought to the board, some people were thinking about raising fees. So Amanda's putting together a little chart of all the health departments, what they're charging now and what they're kind of thinking about. So I'm keeping that on your radar. Carla usually does cost methodology and presents it to the board if any fees are gonna change, usually around August-ish. So you'll get that around that time. So still think about it, but we're gonna get the chart there, just to let you see where everybody is. Some people are charging more for vital stats now, like $30 for a birth and death. Some people are at 22 for birth. So you'll see where we are in what counties, because we're gonna have it down there for you. And I wanted to mention with the Real ID issues that we had the highest vital stat sales since 2017 with people coming in here because everybody trying to get their Real ID. And so, yeah, we've had a good revenue, what do you call it, era, because in 8 years, we've had a lot of them, so hopefully. But I think Ohio, last we checked, and Nancy said we're 50%. As a state. Some states are a lot, California, New York, they're a lot, 25%. I mean, they're a lot, they're not ready. So they said, we'll see, I'll be fine soon, shortly. And I'll see what it looks like out, but they said that no one gets stopped if you don't have the ID. You just have to go into another line and have more TSA time and that kind of stuff. So they're not turning anybody away that doesn't have that star. Everybody knows what I'm talking about, that Real ID star in the top. And we've had ours, most of us have them because the health departments have been talking about it for years. They just really haven't enforced it until now. So we'll see how that goes, but.
Is there a is it just lack of knowledge about how to do it, or is there something that's like stopping people from being able to get them?
Well, they get them when they
Go to
usually they get them when they get
renew.
their driver's license.
Yeah, I think it's a lack
lot
of
people,
knowledge.
Lack of knowledge?
Or
Because-
all the ID stuff.
It's
Yeah.
the document.
I mean, I
Documentation.
got along, they used to tell you, they would do it for you when you renewed
Yeah.
your license.
Right.
Unless
to-
somebody said they didn't
It's
want
the
it.
women.
So for women,
Yeah.
for all people, you have to have multiple forms of identification, but for women now, the requirement is you have to have
Yeah.
your birth certificate, your social security card that match, so your last names are different if you've been married. If you've ever been
Yeah.
married more than once, you have to have the marriage license that shows your last name changed. You have to have the
Yeah.
divorce decree that shows it changed back, the next marriage license. Some women have been married for either 40 years and they got married somewhere far away, and they have to contact that probate court to get that marriage license. Then if they got divorced in a different state, they
You
have
sound
to
like an
contact.
expert.
All day.
Oh my
So that's
gosh.
where it becomes a problem for women. I mean, men, it's not a problem. You get your birth certificate, you get your social security card, and you get something that proves your address. So they're all taken care of. For women, especially, you know, and some women, like I said, have been married to one person for 40 years, but other people, you had a 6-month marriage that you don't tell anybody about, you forgot about, and you have to go track down this marriage license.
I
I've
think though
been
you used to
single
go, I mean, I
and
think.
not
when you-
married and didn't have a problem.
Uh,
Yeah.
Exactly.
No
I
name
think-
change, and that's because of the
More
name
reason to
change.
Yes, because they wanna prove that
When they
you
first
are-
did this, did you have to, maybe you did it so long ago I did it, but, I mean, I went in for my driver's license
You're a
and they
man.
said.
You didn't change
No,
your
but I mean, no, but what I'm saying is for why so many people now though,
I
it's
remember-
not just women. I mean, I had to get a license plate the other day, God forbid. I went in there, I had to sit there for a half an hour because all these people are running to
So
get
the
these.
other issue is,
Mm.
before birth certificates went statewide, every city and county used to have to go to where you were born to get that birth certificate, and they all look different. Some could be on like black paper, some were on white paper, some were big, some were little. They went statewide, and they stopped recognizing those other ones because they're not technically a birth certificate. Those things that have the gold seal with like footprints on it,
Mhm.
they used to accept those for people to join the military, to get married, to do everything, and now they say that's a keepsake from the hospital and it's not a birth certificate. So everybody has pretty much had to come get the
Go to the
state
city.
issued.
Wow,
Yeah.
wow, okay. Thank you for sharing that, because I was just wondering, I remember the first time I went to get it, I didn't have the right documentation with me. I had 2 forms, I didn't have I was missing one thing, and so I had to like
Same here.
read, what do I need, was a lack of, I didn't have the knowledge, right?
Right.
So the second time I was like, I'm prepared, I had more than enough, right? But thank you for mentioning the thing about name change, it's not just women, it's anybody who's changed their names over the years, but
Right.
mostly women,
Mostly.
because
Okay,
of
well,
marriage, yeah.
I don't remember it being such a big for the men then, it's not, because I went and they said, ask a few
Right.
questions or something, and that was it.
And for women that haven't been married, it's.
Yeah,
Yeah,
like,
it's-
yeah,
yeah,
they're getting a lot, they're getting a lot
Okay.
Or
tighter with
changing
that.
name.
The thing too, they're talking about this with voting as well, and the thing really that helps is a passport. But a passport, again, expires every 10 years, it's
Mhm.
more costly or whatever. But the passport has done all that background check, because it's about security issues too. And so when you look at that, so when you go and you look at your name, and I've had Williams, Phillips, and now Carter, right? And I've been Jackie, Jacqueline, I have all these aliases and stuff, so it's just simpler to.
You have to
I'm
bring a
going to-
file
I'm
folder
going
with
to-
you.
I'm gonna become Scott, I'm gonna have all these
You,
different
you
names.
may not have a traffic controller, but
Right.
you'll be able to get on the plane.
Yeah, so it's
After
interesting,
that,
so,
it's-
we have
Good luck.
we have a slip of paper in, that says what information you need too, so that they can kind of gather it before they go, and so, and.
Is there anything at the DMV that, directs people to you guys if they have?
Yeah.
I wonder, does it say the health department, or does it say health department, or does it say Middletown City? Cause
It's
sometimes you
actually-
can't promote, and sometimes you can, do you
I
know?
think it
if
says health
The
anything-
people
department,
working
but-
there tell you,
Tell
you have
them
to
to
go,
go.
you have to go to, you know, the city and get your birth certificate. I
Yeah.
heard somebody talking, you know,
Say
one of
good.
the
That is good.
people doing that.
Cause sometimes you
told
can't
them where to
actually
go.
We
read
have
it.
those forms too, I can drop those off.
Yeah,
Oh, that'd be nice, she's gonna drop them
Yeah.
off.
yeah, but
Yeah,
the
I'm thinking
state,
like a flyer, like they can give somebody.
the state has been giving our department, because we're quick and efficient and get it, so. people
We're-
have- So we've been,
We are the only, like, one of maybe 2 in the state that will offer expedited postal service. So the state does refer a lot of people to us with phone orders, and then we expedite them out. So most departments don't do that.
Well done,
yeah,
so yay, Middletown Health Department.
mhm.
Thank you for taking the time to explain that. Do we have that information on our site as well?
Yes,
online?
it's right on our site,
Yeah,
yep.
so we can
Mhm.
just tell people
Pin to the top under current events.
current events.
Mhm.
Okay, very well. Yeah, 'cause I had to try twice myself.
And we put them outside a tax line, so people have plenty of time to read
Mhm.
and come over and see us after they paid their taxes.
Well,
So-
wonderful. All right, any other
Thanks.
questions or comments? We can move on to board member discussion. Anybody have anything they wanted to talk about, walk with the, I actually did want to talk about that briefly, so the walk with the dog, go ahead.
So Walk with the Doc is this Saturday, a little bit of a change, with our partners at Middletown Connect, we're combining our Walk with the Doc with their Walk and Talk event. So we're meeting at 9:30 Saturday at New Era Baptist Church on Yankee. And I've lined up a nurse practitioner who has her own mental health company, or not company, but practice, Albridge Wellness. And she has a history of working with individuals as young as 4 to like 104. So yeah, and her practice, they see individuals, they do family, but I sat down and talked to her and brought her information, like the request from Middletown Connect, which was talking about the stigma behind mental health and seeking help, disease and medication management, and then how to approach somebody who may be in a mental health crisis. So she is gonna, hone in on those things, but is just there to have conversation and connect with people, and hopefully earn some trust and maybe get people to reach out or pass her information on to individuals who need the help. She's also very connected in the mental health community, so if it is not something that she can address, she can refer out and get people connected to what will work for them.
Can I add one thing too? We're meeting at 9, cause there'll be a coffee truck there and a little
Yes, that's
resource
true.
thing.
The
And then
thing
we're gonna start
starts
at
at
9.
9:30,
Yeah,
but
and
yes.
then the walk and stuff starts at, so if people wanna come at
Yeah.
9, get some coffee, look at resource table, whatever, then the walk
Yep.
and talk, walk with the doc is 9:30, and then we're gonna pick up trash and walk, so.
Yep.
It's also a nice time to socialize and get to know each
Yeah,
other and
yeah.
connect.
Mm-hmm.
I had one question. Did you know this nurse? Do you know her name?
Oh, her name is Lavenda.
Lavenda.
I can't pronounce her last name. It's Mcaulife.
E-I-F-F-E? McCoffee?
Maybe.
I don't know.
McDonald's,
She'll tell us.
She'll tell us. I was just curious if somebody, because you talk about gaining trust, and sometimes it's nice if we already have somebody in the community that knows the person. Does anybody know her from around
Yeah.
here?
As far as with Middletown Connect, I don't think so. I will say in my office, I've had the flyer hanging up, and I did have one of our staff members stop me and say, I love her, she sees my entire family.
Oh, okay, great. Is she based in Middletown?
Yep.
Oh, okay.
Yeah, she's over by where the new Starbucks is,
Okay.
in that building over there.
Okay, very, very well. Thank
Yeah.
you.
Where
And
do you advertise this walk with the dog? Cause I've been talking to people and they know nothing.
They know nothing about it, I
And
know,
I don't
so-
even know that it's out anywhere.
We advertise it on our Facebook page, hospice, yeah,
Yeah.
and then on our website, Middletown Connect puts it out.
Where would, and the hospital puts it out, where would be a good place? Do you want we can get flyers to your place?
I can get it up to you
Nobody
guys.
knows anything about it.
Yeah.
I've been taking a survey and they're like, what?
Yeah,
I don't know, the community doesn't know
mean,
about
that's
it
part of
unless
it.
you're.
and I share it on Middletown Talks too, but this is the thing, I share it under hospice, and the last walk I tried to share, they would not approve it because they got it confused, I think, with our 5K, and they're like, you're trying to promote too many things at once. But they'll approve any political post you put out there multiple times.
So we can get flyers to you to put them up maybe at your place, that communication always.
I can include you on the email when I send out the flyer to our partners, if you
Okay.
wanna print it out, or I can print it out and bring copies to you.
I mean, either doesn't matter, but
Okay.
I just,
Yeah,
was
but
curious, nobody really knows.
I know,
about it.
and we were trying to get them out to churches, they're gonna start sending that information out to churches to put them out further.
Right,
But we have to keep finding ways, when people say they don't hear about it, what way is the best way to get it to them? So the person that says to you, I haven't heard about it, where can we put it for her or him? You know what I mean, we're just trying to get it. Kroger, sometimes you can put them up at places, but often places don't let you put all your stuff up there, and so,
And also.
I don't do Facebook either, but we have
Yeah.
posters out here, but.
yeah, but,
So the thing too is that when I put stuff out, I try to say, this is gonna be the topic, this is gonna be who's talking. But the idea is to have it at the same
Yeah,
place
it
at the
does.
same time
It's on
every
Facebook.
month, so that even if you don't necessarily care what the topic is, you know to show up.
sure.
And
Is it
we're
generally
just
the
trying
same
to,
people every time?
the same, like walkers?
Yeah.
Yeah,
Yeah.
It's
And it's-
usually the same walkers, but we try to get different
Sure,
speakers
but
different
or
the
same
same
doctors.
people
yeah.
are just, so
Yeah.
we're not really
Yeah.
getting,
New.
so I
more
could
people.
put out generic, like, walk with the doc, you know, usually meet at Rosa Parks, that's the other issue, is that we're changing it up a little bit, and I think we're hitting on our 1-year mark, and we actually, us partners, need to sit down and discuss if we even wanna continue it, cause we have to pay dues.
I would like
So-
to make a suggestion if possible,
Mhm.
utilizing our businesses and their Facebook communities. 'Cause I know, our health commissioner is saying that we do put it on the city's Facebook page. I announce them during council meetings, during
Yeah.
council comments, but, one of the things that we could do maybe is talk to our local businesses, especially, with DMI downtown, because they have such a great network already. And just asking them to post it perhaps on their business Facebook, because that reaches another niche, like
Yeah,
a
that's
certain population that wouldn't otherwise be reached.
Chamber.
Yeah.
Right, the Chamber of Commerce, we could ask them to do it as well, because it is such a lovely way to meet people, to get out, to get fresh air and exercise, it's so much fun. Even though it's early on a Saturday, like, it is so much fun.
Yeah.
But that's just something, 'cause I hope it sticks around, I'd like for us to continue.
Yeah, I think that, like I said, I've gotta get all of the partners together and
Maybe
figure out
discuss.
where we're going from here.
Also, if, I always say, just as a personal citizen at this point, like, whenever there's anything going on in Middletown, give us at least 2 flyers or posters for the bakery, the Central Pastry Shop, because we'll put them on our doors so that people see
Mhm.
them.
Yeah.
And I did that for the last walk with the dog, 'cause I had the flyers.
Yeah.
But maybe as soon as they're out, we can start, I don't know, going to businesses or going around and just handing them to people.
Yeah, yeah.
Like
And
Triple
like I-
Moon and
Yeah.
just places.
I've also tossed around the thought in my head to have a separate Facebook page for just Walk with the Doc.
Mhm.
But again, that's a conversation we need to have with the partners
Mhm.
and figure
True.
out if we wanna go that route. I think it would require a couple of us to be administrators over
Mhm.
that, so.
And they had 10 questions to ask a doctor at the Walk a Dog emails, I try to send them out to you guys if you ever get them. But it's this funny guy that is a doctor that always writes this newsletter, and he had 10 questions to ask your doctor. And I sent it to our church, and our church sent it out to the group.
Oh, great.
Cause it's good it was good questions, and he said, if you feel bad about doing it, the person before you did it and the person after you's gonna do it. And then they said, and the doctor doesn't know how to pronounce these words, you might wanna find a new doctor. He just says different, he's just kinda kidding around, but it kinda loosens up things too. And I try to remember to send that out to, people, because I can forward that email. So we'll get it, we do need to have a meeting, it does cost. The hospice foundation and the health department supported the initiative last time, so we have to see if we have to divide it up, maybe get more sponsors so it's less costly. So we'll get back with everybody, and I do think, the more I think about it, the cemetery might be the best place for the walk. Before, we were walking in the census tracts,
Yeah,
so that you can get out, see the community, and pick up trash and kind of, but if we're talking about mental health issues, or if we're talking about health issues or whatever, it might be nice to be in a serene place where it's calm and you're not picking up trash, because you can just focus on the walk and the dock and the health talks. So
Yeah.
we'll talk about that too. There's so many
Yeah.
different ways to look at this.
yeah, and I
so-
think once we solidify our plan moving forward,
Mhm.
it'll be easier to get information out to everybody. We have a set place, a set time. If we've got people have said 9 is too early on a Saturday. I don't believe that, but for some people it is. So if we push it to
Cooler.
9:30, will we get a better response? I don't know. But
I mean, it's cooler.
once we figure all of that out, we can push information out that's just basic, like this is always when it is, this is always what time, come join us.
Yeah.
It's a lot of fun.
Yep.
Thank you.
Okay.
Thanks. Anything else that, any board members would like to talk about or announce, comments? Just a couple of things. We have a new, fire chief, awaiting council approval. Brian Wright was promoted to fire chief, so hopefully we will be, he's wonderful if anybody's met with him. And also, speaking of the fire department, we have the open houses this Wednesday, so tomorrow.
excited.
Yes. If you'd like to see 2 of the new firehouses, and they are spectacular, you can find it on our Instagram, but it is tomorrow, May 14th, starting with our fire headquarters, HQ, which is Station 83 at 1830 Yankee Road. It's 1830 Yankee Road, so it's kind of like nestled right off of South University there. That starts at 10, about 10:15 will be the ribbon cutting, that goes until 11:30. And then they're at Station 82, that starts at 12:30. Station 82 is located at 3515 Atrium Boulevard. That's 3515 Atrium Boulevard. That one, like I said, starts at 12:30. The ribbon cutting will probably be 12:45. It'll go until 2 p.m. That one's near the mall, or not the mall, the mall. It's near the hospital, and the new Renaissance Point, and the old mall. And then also to accommodate people who work, by popular demand, there are going to be those open houses just in general from 6 to 8 p.m. And you can go to either station, first or second, whichever one you prefer. But highly recommend it. Plus, the big thing I can't wait to see are the tables. The firefighters get to design their own like communal table that they eat their meals at, and I guess they're all very unique and they're all very personal and historical and just a lot of fun. So that'll be a nice unveiling as well. All right.
The fire stations are pretty cool.
Yeah.
They're pretty, they're neat.
Once
yeah.
you tour one, I toured one up in Troy, Ohio, like a couple years ago, and it was a new station. And you really grasp, like, that is their home. I mean, it's a brotherhood too, but it is really their home, away from home. And I happened to tour when they got called out right before lunch, and they were in the middle of cooking. But it's, once you tour, you get a better sense of how important it is for them to have such updated accommodations.
Absolutely, yeah. And they also have, I really loved, it is like the tornado room, it's completely on the inside, so that's where I would advise anybody run to a fire station, because they got the best place to be. And they, yeah, they really, and then it is so much light, you guys, and if you guys have been in any of those old firehouses, they're kinda creepy.
Yeah.
And these are bright and light and really cool. You know what I mean? I think I wanna be a fire person.
They are beautiful.
Oh, yeah, yeah.
No, I didn't. I haven't found
Blackout
it.
Yep.
shades.
Everybody has their own
Is
bedroom.
there any comment on this? Have you noticed anything? There's $163 billion.
That's a hospital,
Just a
yeah.
comment on that, maybe?
Yeah, that's a hospital, so we are still, getting information, I put it in there about regarding, and you may have heard of this, Emily, is more too, but Health Collaborative sent out information, talking points of how to talk about funding to any representatives, but this is the hospital's, their public health emergency planning stuff. So anything that they received, they received software to how they can account for how many beds are available during emergencies. So if you have to divert, the transportation, and automatically if it was a big event and you're getting ready to take, EMS was gonna take people to the Middletown Atrium has already notified them there's no more beds to take them to Mercy or take them somewhere else or whatever. So all of this was built on, these dollars. Ebola money, when we had to do all of that training, when that comes in, it's just a lot of, like what negative air pressure rooms, when they do those kind of things for TB. It's just a lot of things that go into this ASPR dollars and these bioterrorism emergency preparedness money. And so they're concerned about that. $63 billion is a lot of money. So they were saying just different talking points, and so we're hearing more about it. I just keep putting things in there that if you hear things go away, or if you're hearing things done differently, these are the monies. And I think often people don't know what those monies mean or what they're being done with them. They just think it might be excessive. And those are the dollars that help cover staff, might help cover, some health departments were receiving money that they are ready to pour concrete for additional space, and they can't finish. They said they have to get it from their local coffers, and so still going on. Anytime I hear about those things, I just put them in the packet so that people hear about them. They had some norovirus funding that was taken out, and they were trying to scramble to put that back in. ODH lab is supposed to be closed. That's fairly important. That is set to close for money. ODH takes specimens from hospitals, from all around. So they were talking about that. They were talking about taking, it's just a lot of stuff. They were talking about taking money away from lead, children's lead and the lead abatement program and children, all that, and put it somewhere else. And so we're just waiting to see where that money goes,
Yeah,
I mean, or how it goes.
That's what I'm gonna ask, where's the money going? If we're gonna take all this money away, what are we getting for it? Where's it gonna go? So, just saying. People
I don't
need
know,
to-
I mean, there, as people at the state talking about this.
Yeah.
Somebody, I might serve on a committee for a year, I told them I was, but they were needing nurses on the committee at the state level sometimes because it's all environmental directors on there, and they want money to go to solid waste versus lit programs, you know what I mean? Versus maternity and health programs. And so it's, when the money gets shuffled around, it's to things that they think makes more sense than if you have an outbreak or if you start having high rates of. So we'll see. I mean, I think that's the way kind of it always kind of happens. You gotta wait until you're saying, well, what happened to this? And we can't afford it. I don't know where that is. The hospitals, have you heard any of this with the, yeah, the Health Collaborative and, yeah. So they were glad, they try not to let a lot of this information kind of get down to staff level, cause it may never happen. And they don't wanna have a whole lot of anxiety until it does or doesn't, but
Right.
people are always looking at other plans.
So the money's not gone yet, or it is gone?
So far, I don't think it's
Not
gone
yet.
yet.
Not yet.
It's not
But
been
it-
signed into the budget.
Yeah, but it's good to know about so we can speak to our elected officials and kind of get our voice out there saying this is, we need this.
Just like when Chandra was reporting on the public health emergency, we usually have that grant in here pretty soon, but that may not be there, and the epi money may not be here too, so you're hearing epi surveillance and stuff. So you have to say, maybe not. Or I said we might have to take the money that we get for horses, that's why I said we have, I'm just teasing, but I said, if horses is funded, then we gotta
Oh,
take
so
horses
move
out
it
there.
Someplace else, huh?
Yeah, we gotta move the horses with the, I said, if they get rid of the diabetic money, then when we get horses, we have to pay diabetic patients on the horses. We just gotta shuffle it around. You gotta be creative. I'm just teasing, I don't know where it's gonna go. Maybe nowhere, so we'll have to wait and see.
All right, well, thank you very much for that. Any other discussion for open board discussion? Hearing none, okay, then, I do need to call the executive session. Will we have enough to adjourn after the executive sessions, others can leave?
I think everybody's here except Jeff.
Yeah, I
Oh, yeah.
mean,
Oh.
do they need to stay, or can we just adjourn out of, like?
Yeah, if they adjourn, if you just let us know when they adjourn.
Yeah, that's
Okay,
What time?
That's enough, okay.
Yeah.
All right, so at this time, then, I would like to ask for a motion to, move to executive session under the authority of ORC 121.22G1 to consider the appointment, employment, dismissal, discipline, promotion, demotion, or compensation of a public employee or official. Is there a motion?
So moved.
Thank you. Is there a second?
Second.
It has been properly moved and seconded. Ms. McDonald, please call the roll.
Mr. Richmond,
Yes.
Ms. Zipsey,
Yes.
Ms. Baggett,
Yes.
Dr. Zollett,
Yes.
Ms. Lawley,
Yes.
Mr. Bonnell, Ms. Miller.
Yes.
All right, the yeses have it, and we will now move to executive session when we return to open session to adjourn. Thank you so much.